2 years ago, cancer woke me up to the epidemic of isolation and loneliness. I was the chief technology officer of the world's largest residential real estate company when I was told I had a tumor the size of an orange in my body. That cancer diagnosis stopped my busy life and showed me just how far I drifted from the important people in my life. I quickly realized that it wasn't just me. Loneliness is an epidemic, one impacting over 100 million Americans and hundreds of millions more worldwide. Whether you're a young person overwhelmed by social media, an adult too busy to connect, or the elderly that struggle with chronic isolation, the impacts are all the same. A rise in anxiety, depression, and suicide, all resulting in a growing burden on the healthcare system. The epidemic of loneliness is causing billions of dollars of preventable healthcare costs. On a per-member, per-year basis, this preventable cost is on par with that of the biggest chronic diseases. Right, but loneliness is just a symptom of a lack of engagement with the important people and resources in our daily lives. That means that the solution for loneliness doesn't lie in the medical industry. And that's the reason why medical apps and medical newsletters don't solve the problem, and is the reason why call centers full of nurses and social workers doesn't scale. Digital platforms are the way that modern industry deal with this type of a communication problem. But while we have digital platforms for virtually every dimension of our life, we don't have one for the most important dimension, our health. That is until now. Porchlight is a digital platform that creates high-quality connection in a busy world. I'm Steve Peterschmidt, the CEO and co-founder of Porchlight. Porchlight begins by using behavior science, trusted private networks, and modern technology to create the tiny habits that make it easy for people to connect with people. Then we expand the tiny habits concept to make it easy for people and resources to connect. People get the help that they need when they need it, and resources like healthcare systems get a new level of access and information about their members. Research shows that people that are engaged in their own health are less likely to be admitted to a hospital or use the emergency room, and more likely to participate in wellness programs. Porchlight is a digital platform that creates high-quality connection in a busy world. We have an experienced leadership team with a combined 5 profitable exits, and we've run businesses in healthcare, technology, and consumer goods. We've raised $1.4 million in total, and that includes closing a $1 million seed round just last month. In September, we started generating revenue. Right. Our first release is a consumer app that creates high-quality one-on-one connections. This daily 20-second interaction becomes an anchoring behavior that gives the rest of the Porchlight platform an unfair advantage over the hundreds of other health and wellness point solutions that exist in the market today. Just as social media is a digital platform for our social lives, and LinkedIn a digital platform for our careers, Porchlight is a digital platform for our personal lives. That makes this a huge market. Our market entry point is with the struggling relationship between college students and the adults that love them. These are two groups desperately needing connection in a way that gives the college students the freedom to grow into adults and gives the adults the ability to just know how their students are doing so they can be there for each other in an adult way. Last year, we had over 1,300 people in 7 countries and 48 states have over 60,000 interactions on the Porchlight platform. I have no idea why Wyoming and Rhode Island are holding out on us, but it's just a matter of time, right? All right, so we built the platform, we've tested the hypothesis, and this works, right? 2020 is about focusing on growth in virality through our existing subscription model and by adding a healthcare sponsorship model that gives healthcare providers and companies a scalable way to engage with their members, reduce churn, and prevent cost. I said that backwards, didn't I? Prevent churn and reduce cost. All right, we have 2 asks today. First, We want to develop relationships with institutional investors that have the vision and scale to help us create the next great digital platform. We're also looking for partnership with healthcare companies that are ready to transform their relationship with their members. So today, loneliness is an epidemic. But imagine a world where people are engaged in their own health because they have a trusted platform that makes it easy for them. And where healthcare systems don't spend billions of dollars on loneliness because their members are connected and because they have the information and access to help those members live healthy lives. This is a world that Porchlight is building. I invite you to join us.